So now I'm here with Jim Mazzo, Worldwide President of Ophthalmology at Carl Zeiss. And Jim, we're also asking you that key question today. If Mozart were alive and well, what ophthalmic tools would he use? But Jim, I've got to warn you before we start, I'm not much of a violinist, so if we hear too much promotional stuff, I might just start playing.
That's actually that's a beautiful outfit. I have to tell you, that matches your eyes absolutely perfect. So I'm going to assume you're Mozart, because he would have been very proud.
Amadeus, thank you.
That's absolutely perfect. So, the one thing about Mozart is he was very creative.
All right.
He put a lot of things together, put a lot of notes together to really create a masterpiece. So I would tell you what's new today is that the doctor has to create a masterpiece with technology because he doesn't have the availability, she does not have the time to see every one of the patients. There is a tremendous phenomenon today where there are more patients and less doctors.
Right.
So if Mozart was around today, he would having all kind of music being flowing at him. The question is, would he be able to write it all down? And if he can't write it all down, he doesn't have a masterpiece.
Okay.
So really what has to happen today for that physician is to be able to diagnose that patient up front, to properly diagnose that patient up front, so that when they walk into that office, they know if they've got a red, yellow, or green.
Right.
I don't think Mozart was colorblind, so I think he would have been able to recognize, and that music actually comes in colors to musicians. They actually see notes in colors.
Amazing.
And so if he saw a color today, he would see red, yellow, green for his patients. And what would happen there is they need to diagnose those colors. If a patient comes in and they know it's red, then they know exactly what the problem is. So that note would hit a high pitch.
Sure.
If it was green, a low pitch note, that means that patient is okay, a real recognition between the physician and the patient. But yellow is where we need to help the physician. And that's what we're trying to do, is properly diagnose the patient so that when we treat them with our great technologies, they've properly identified, or in your case, the right note. Unlike your playing, we would hit the right note. And so at Zeiss, we diagnose and treat. We need to identify the correct note between red, yellow, and green. Because if they're not properly diagnosed up front, you're going to get the wrong treatment, or the treatment that could delay the onset of the problem. So that's what we're trying to do, and that's the challenge Mozart would have today.
Now, you were talking a little bit this morning about artificial intelligence also helping in diagnostics. Do you see that as the future at Zeiss as well?
So I said earlier today when you were in the meeting, and again, thanks for coming, he or she who owns the data will win in the eventual day. So I'm not sure if it's artificial intelligence or just let's work with the word intelligence.
Yeah.
Goes back to the point that we need to capture that information. That doctor needs to have that information prior to going to see the patient. Once they have that information, however they have that information, will make them a better physician. I think the term artificial intelligence is being overused today for really just having intelligent data at their hands. The old days, pre-Mozart, 1400s, couldn't survive. You can't continue. So today, Mozart needs to have the information at their fingertips. Let's think of that retina patient. Okay? That retina patient today is somebody that if they're haven't been diagnosed, the physician clearly needs to understand what's going on in the back of the eye there. Clearly needs to see, can't assume anymore, because they have 20 patients sitting in the room. Or the patient that has been diagnosed, at the fingertips, let's see what they looked like 2 years ago, what they looked like 6 months ago, and what they look like today. We have provided that information at Zeiss. Easy access information. Is that artificial intelligence, or is that intelligence using the correct information to make the right decision?
The point that your colleague made also was that I believe that in OCT images by Zeiss, you're often using the native files so that you can sort of historically over time look at true issues within OCT rather than artifacts.
Angelo, who you're talking about, runs my division for all diagnostics, does a fantastic job, and he mentioned something that was real critical. It can't be on paper anymore. But not only cannot be on paper, the patient wants to see what the doctor is communicating, the issue. The patients want to know, what is my problem? And by us being able to show it on the machine, that here's what you look like 12 months ago, here's what your eye looks like 6 months ago, the patient is now involved in the decision making. Mozart is able to communicate the beautiful music because there it is, the data is visible. And that data that's visible engages the patient and makes the doctor have a better decision. So using your Mozart analogy, can't be overwhelmed with beautiful notes, has to be able to take that, synergize those notes, put it on music, put it on a piece of paper, and be able to really communicate and play a little better than you can.
Well, I don't know if Elon Musk can play better than myself or not, but he's also brought up something recently in some YouTube videos about artificial intelligence in the future. He's a bit wary of it. So I just wonder, if at the highest levels in our industry, philosophically, are there also dangers with artificial intelligence? Would Mozart be scared of a future where perhaps machines are running things, or any take on that?
I'm not intimidated at all, and nor should anybody be intimidated by artificial intelligence, because the concept of artificial intelligence is to take menial tasks out of our day-to-day to be able to unleash our brain. There's a statistic that we only use 10 to 20% of our brain.
Yeah.
If we can use artificial intelligence to take some of the menial tasks out of our great physicians' hands and allow them to use more of the capacity of the brain, the patient wins. So artificial intelligence doesn't take away anything. It actually enhances the ability for somebody to make a real decision, takes the menial part out and be able to utilize that God-given brain that we have.
Well, just so you know, Mozart uses about 30% of his brain, so just saying, analog still works.
Well, and again, why can't we get Mozart to do 40%? Could you imagine if Mozart had 40% of the brain? So I would say, don't be intimidated by artificial intelligence. I think the term almost intimidates, but the concept that we can take menial tasks out of our day and enhance our capabilities, I think that's a win. But again, goes back to my premise. More patients, less doctors, they have to have information in their hand. At Zeiss, we're providing that information so that he or she can better treat the patient. Mozart would be proud, Strauss would be proud, Beethoven would be proud, everybody would be proud because we'd have better music.
And final question, I first started hearing about artificial intelligence a few years ago related to intraocular power calculations. But I wonder if in the retina space, it's particularly apparent how artificial intelligence can be used to make diagnoses in the future. Do you think that the posterior segment is ripe for this kind of learning?
Again, I truly believe so. Because what I believe artificial intelligence does is take the menial tasks out of an everyday. Think of what your retina physicians are. There aren't a lot of them across the globe. In fact, it's a very condensed environment. They're challenged with a disease that really has no known cure today. They're challenged by compliance. So they're constantly challenged by menial things that really reduce their effectiveness. If we can help them be able to reduce the complexity of their position and be able to unleash that power, again, I do like this Mozart comparison. Now you got me engaged in thinking about Mozart. He was superior in intelligence, but think about how much more he would have been more effective. Think about the type of music he would have been able to do if we could have taken the menial tasks out of his day-to-day operation. If somehow we can unleash more brain capacity or just more time in our day to be able to really make critical decisions, who wins? The patient wins. And that's what we're here for. You're here to help communicate. I'm here to ensure that they have the proper education, but we're here for the same job. We've got to make that physician more productive. Artificial intelligence makes them more productive. But I go back to it, if we're not diagnosing early, if we're not providing the doctor with the right information, if he or she cannot communicate that to the patient, we have a problem. That's what we're trying to do. You call it artificial intelligence, I call it take away the menial tasks, give them the power that he or she needs to make the right decision, patient wins.
Wonderful. Well, Jim, thank you for joining us today. And as a little treat, I'd like to serenade you as we leave off here. So
I must have been really bad to hear this.
Yeah, absolutely. All right. Thanks for joining us at Pi Magazine, and we're here and always here with creativity and innovation.
That's beautiful. That's absolutely beautiful. Thanks,
All the
man.
best.
Thank you. Thank you.
Thank you.